Hello, in this video we will teach you the basics of a radial head subluxation or nursemaid's elbow reduction. We will 1. Identify the mechanism of the dislocation, 2. Correctly position the patient, and 3. Demonstrate proper technique. The purpose of this video is purely educational. Let's go over your needed supplies, popsicles or stickers. Indication to perform a nursemaid's elbow reduction, lack of full range of motion of the upper extremity. Before performing the procedure, take a thorough history and physical. This injury is seen mostly in toddlers, and the typical story is that the arm is somehow pulled, causing immediate pain and limited range of motion. This often happens when the parent is trying to pull the child up from the arm, swinging the child from one arm, or pulling an arm through a sleeve. On physical exam, the patient will be calm and hold his or her arm out supine, extended, and normally resting on his lap. Be sure that there is no posterior elbow tenderness or obvious swelling. If there is, you should have high suspicion that there is a supracondylar fracture and need to confirm with an X-ray. If you feel strongly that it is indeed a nursemaid's elbow, first explain to the parent what is going on. What is happening is that the annular ligament has slipped off the radial head, which is limiting the patient from rotating his arm. I normally compare this to a sock hanging off a foot, and we need to pull it back on so that we can move around normally and safely. Explain that you will first examine the good arm and then proceed to the affected arm. The reduction will be quick, and the patient will cry and scream in that moment. Have the patient sitting on the guardian's lap and you facing the guardian. It will be as if you two are touching knees. After examining the good arm, move to the affected arm. With your non-dominant hand, use your thumb to secure the annular ligament and wrap the remaining fingers around the patient's elbow. With your dominant hand, hold the patient by the wrist and either hyperpronate or hypersupinate the patient's forearm. You will feel a pop in your non-dominant thumb. Immediately, hand the patient a popsicle to the once affected arm and leave the room. Return to the room in about 5 minutes to hopefully see a happy child with full range of motion. You do not need any imaging to see if your reduction is successful. You do not need to splint the arm. You have now completed this video and should feel confident in performing a nursemaid's elbow reduction.